For years now, we've heard how dogs have been a vital asset to police units. Well, today around the U.S., hospitals are making use of these canines as they're proving to be a vital asset to patients and staff alike. I'm Sarah Zato with Civic Center TV here at Henry Ford West Bloomfield Hospital, where we're getting an inside look at the therapeutic dog program and the services that they offer.
Our program began here at Henry Ford West Bloomfield actually before the hospital opened in about November, December of 2008. We were working at purchasing a facility dog, and that's what's a little unique about our hospital is that we have two dogs that we actually own that do pet therapy here at the hospital. So they were Henry was purchased in 2008, and he was present when we did the grand opening event, so people that were coming to our hospital had a chance to see him and learn a little bit about our pet therapy program.
All dogs involved in the program must go through official certification and evaluation alongside their owners.
At Henry Ford West Bloomfield, all dogs that are going to be part of the program do have to be certified therapy dogs. That means they have to go through the testing procedure through any one of a number of certifying programs that are nationally recognized as pet therapy programs. Most of them have pretty much the same requirements, largely that the dog is trained, that the dog is obedient, that it's the right temperament, and they go through a battery of tests. Throw it down. Go through a battery of tests as far as what a dog might encounter in visits. Things like wheelchairs, walkers, canes, people that might be unsteady, children running, all the types of things that can be very big distractions to dogs, and they've got to see that the dog can handle all of that. And just as importantly, that the handler can handle their dog while those things are going on.
From visits to hospice and emergency rooms, the contribution from the therapy dogs has been overwhelmingly positive.
There was a young child that had cut himself very badly, had to be stitched up. And he was screaming and crying and squirming, and they just couldn't get him calmed down well enough to really be able to safely work on him. And somebody came in and said, do you think maybe you could bring your dog in and they could distract the child and we can work on him? So I said, sure, we'll do that. We brought the dogs in, and the child went from screaming and crying to fascinated by the fact that we brought a big dog in. And he watched the dog and he smiled a little bit. We let him pet the dog a little bit. And at that point, while he was watching the dog, the doctors were able to stitch him up, and he was fine. And after that, we were asked, could we make the emergency room part of our regular rounds?
In many occurrences, the therapy dogs have proven to be a source of happiness and hope for both patients and family members.
If you visit someone who's maybe been in oncology, a cancer patient who's having a rough time, who suddenly just falls to their knees, hugs the dog and says, boy, did I need this today. If that doesn't make you feel good for the entire day, nothing will. And when people tell me, boy, it's a wonderful thing you do with your dogs in the hospital, it's so nice of you to do that as a volunteer. Not really. We get so much more out of it than we put into it.
We've all heard the saying before that dogs are a man's best friend. And here at Henry Ford of West Bloomfield Hospital, these words ring true as the therapeutic dog program has helped patients and family members alike. For Civic Center TV, I'm Sarah Zato.